recent posts I've talked about diastasis recti in postnatal women, but a really good question is, how can you prevent this from happening in your pregnancy? So a quick reminder, diastasis recti is the separation of the top layer of your abdominal muscles called the rectus abdominis, which are held together with connective tissues called the linea alba. Now, as you're going through your pregnancy, your muscles will be stretched. There's more intra-abdominal pressure pushing against them from your grown baby, your lifted uterus, expanded uterus. So this can cause the stretching and separation. 66% of women actually do suffer with diastasis after their pregnancy. So it's very difficult to say you can prevent it from happening, but there are ways that you can strengthen your other abs and help with healing and recovery after. So the ones that you want to be focusing on in your second and third trimester are your inner abs called your transverse abdominis. Now they run all the way around your torso. They're the inner layer of abs, but they do wrap around your baby, so they support all of your internal organs. When you're in your first trimester, you can actually do everything the same as you were doing before for your ab work. You can do crunches, planks, if you feel comfortable to. So some women may not feel ready or able or comfortable to do this, and that is totally fine. You can dial it down. For example, in a forearm plank, you can just come down onto your knees instead, so you won't have as much pressure onto the front of your abdominal wall. Now, when you're going into your second trimester, this is when you need to start to modify. So you shouldn't lie flat on your back. Have something to lie against from your shoulders and upwards, so you have a little bit of a gap underneath your lower back, and this will just help to take pressure off your lower back. Now, another thing that's great to do when you're through all the trimesters, pelvic floor muscle exercises and pelvic tilts. So pelvic floor muscles, they work in conjunction with your core. They they hold everything together and keep everything really strong. So there's going to be a lot of pressure on them when you are pregnant. So you just need to make sure that they are strong first. Pelvic tilts are great because with the increased bump, your lower back is going to arch naturally. So by just tilting your pelvis backwards and forwards, it's a really great way to strengthen your lower back muscles, but also take that pressure off. And this in turn will work your transverse abdominis muscles. So they're great to do lying down with the support. You can do it seated, you can do it up onto a chair. I've got a Swiss ball here, which is amazing to work with, especially when you are coming into your third trimester, because it just feels nice. It takes pressure off your hips, off your lower back. It puts your lower back into the correct position, into a neutral spine. So you can do your pelvic tilts here if you feel comfortable too. And another thing, to really focus on your transverse abdominal muscles, bring your hands onto your belly so they can be out wide around your rib cage. Connect your deep breathing with activating these muscles. So inhale, feel your belly expand, feel your ribs expanding slightly, and then as you exhale, exhale through your mouth and feel your muscles starting to wrap together. So you can think of it like your arms are wrapping around a beach ball, or as if you're hugging someone. It's that same feeling here. So inhale, and then exhale, feel your muscles wrapping around your belly, around your baby, and think of trying to get your fingers to knit together. So those really simple exercises are so effective to work these inner abdominal muscles. Try to continue to do those throughout your pregnancy, and then you will feel so much better after you've had a baby. These muscles will be stronger and will go back together quicker and be able to heal and recover.